And very warm welcome to all of you. My name is Adelina Comas Herrera. I'm the director of the Global Observatory of Long-Term Care, and I'm just doing a brief introduction to today's webinar. Just so you know, if you're new to the observatory, this is a platform for cross-national learning to improve and strengthen care system. It's part of the International Long-Term Care Policy Network. And our aim is to identify key shared challenges in long-term care, showcase how different countries and localities are addressing them, share research evidence, and facilitate collaborations. And this is a platform that's for everyone, for policymakers, industry, advocates, care professionals, academics, anyone interested in long-term care. It's hosted by the London School of Economics, and now we're working to develop national hubs, regional hubs. Our key activities is that we have this very big database we're gradually building up, organized by country, territory, topic, and methods, covering from who are the experts working on long-term care, what are the research projects that are going on, publications and videos. We have interest group webinars like the one you are at today, and we also offer some other services. And to engage with GOLTC, the most important thing to do is to become a member. This is free. And all we do is to verify that you really are a real person and you have an interest in long-term care, but you just need to complete the information in the link. We'll also share it in the chat. And this will give you an opportunity to share your knowledge, to find others with similar interests, share relevant publications and events, and you can also subscribe to the newsletter. Today's webinar, we're really, really happy to be co-hosting it with the World Health Organization Regional Office for Europe and the DG Employment Social Affairs of the European Commission. And we're going to hear about the state of long-term care assessment and how that's been used in Ireland and Greece. And our next event after this will be a meeting of the Spanish interest group. So this will be in Spanish on the 15th of July. We then have a webinar from the quasi-experimental methods interest group looking at outcomes of institutional versus home-based care, especially in terms of hospitalization. And there'll be another one on the 17th of September on pain assessments in long-term care from the Pain in Care Homes interest group. And then many of us will be meeting in person in Bilbao. Here's a reminder that you may want to register for the conference. It will be an excellent program. And we'll also be hearing from Stefanie Elinka from the World Health Organization as well. So that's all from me, and handing you over to the team. Thank you.
So thank you very much, everybody, for joining today. My name is Cassandra Simmons, and I'm working as a consultant for long-term care with the WHO Regional Office for Europe. So I will be presenting in a sec, but first I'd like to give the word to Diana from DG Employment to kick off the webinar with a few words.
My name is Diana Erikssonaite. I work in the European Commission, DG Employment, a unit called Social Protection, where the long-term care team is located, working on the European care strategy. So here, just to open the webinar, a few words of context, EU level policy context of where we are in long-term care at the EU level. So basic information, long-term care, the responsibility lies with member states or regions in some member states, and the European Commission can facilitate cooperation on common areas of concern, which is the long-term care. The challenges are common. So the Commission can provide guidance in the form of recommendations, for example, can launch studies, evidence gathering, and then, of course, can direct the different EU funds to this policy area. So long-term care as a specific policy area is not so old at the European Commission. The attention started building to it in the context of demography discussions. We have every 3 years, colleagues are publishing reports, aging report, pension adequacy report, looking at the challenges of aging. And then since 2014, now we have a joint report, the Commission with member states on long-term care, because aging poses a lot of challenges to the long-term care sector. Needs are increasing, worker shortages, and overall lack of funding for other challenges puts the sector at a disadvantage. At the European level, also since 2017, we have a sort of guiding compass of our social policy called European Pillar of Social Rights. It comes with different principles for policy areas. And there is one specifically dedicated to long-term care that asks to guarantee access for all who need to long-term care of high quality, especially home care and community-based care. So the attention was to the sector came through the demographic gate, so to speak, but then we had COVID. We saw what's happening in long-term care, especially in care homes. It put a flashlight, it put a light on the already difficult conditions, poor quality, shortage of staff, people in precarious conditions in the care, receiving care. So in 21 already, when we prepared the second long-term care report, we talked more about the need to act now, and we analyzed different challenges in the European Union. And then in 2022, the Commission published the European Care Strategy and the Council recommendation, which I'll say a few words later. And now this year, we have just had European elections. Well, while we wait to see what it brings concretely for the care sector, but looking at the manifestos of different parties, we see a lot of attention is being paid to this sector, and different social organizations, social partners, civil society organizations at the European level continue to call for more and more robust action in this area. So the European Care Strategy adopted in 2022, it came as a package, it came as a communication on the care showing the EU vision for the care sector, covering childcare and long-term care, so life cycle approach. It announced a number of EU-level actions that the European Commission was about to launch, and then it proposed two council recommendations, one on long-term care, on childcare, on Barcelona targets, and one on long-term care, which were adopted by the council, by member states in December 2022. So here I will say a few words only about long-term care. On the screen, you see big building blocks of the care strategy and what we focus on. We focus, of course, on the services themselves, on the availability, quality, accessibility, affordability. So here the main action is the recommendation, which provided guidance to member states on these particular dimensions. We also have technical assistance through one EU fund that can help member states design the necessary reforms. We have international cooperation, of course, because these problems are global. So we work with OECD, looking at trying to measure adequacy of social protection for long-term care. And of course, the topic of today, we started working with WHO on developing a tool to help member states self-assess their long-term care systems. We also have other funds that fund innovation in the sector, digitalization. But then, of course, we have a big block of actions on workforce. This is the biggest problem across the EU. And we also have, at the EU, we already have EU labor law, which applies to the sector. But we try to look how this labor law applies, if there are gaps, if there are problems of application to the sector, or if there are gaps in the labor law itself, which need to be corrected. So studies are ongoing in that respect. We fund actions to improve skills in the sector, social dialogue. There is also a work-life balance directive trying to help informal carers, for example, to combine working and caregiving. There is, of course, a huge part of a care strategy dedicated to funding. First of all, arguing that funds for care are not to be considered as a cost, it's an investment, and providing different arguments. That's why we need to ensure adequate investment in the care sector, promote public-private investment, and then we provide an overview, and I will come back to it a bit later, of multiple of EU funds that are available for care. And of course, another big challenge everywhere at the EU, at national levels, is the lack of data. For good policy design, we need data. At the European level, we need data to compare, to learn from each other. So we have an action working on the European level statistics. We have cooperation with CEDEFOP looking at projections on demand for care, again, research. We use indicators that we have in the European semester to monitor policy developments. And as the European action, we organize mutual exchanges and learning for member states. Now, a few words about the Council recommendation on long-term care itself, which was adopted in December, as I said, 2022. It has these big, I would say, 5 building blocks. First of all, looking at affordability of long-term care, asking member states to ensure adequate social protection, which would allow people in need of care to access it when they need it and for as long as needed, which would allow for long-term care to cover all their needs, would be comprehensive, and would protect them from falling into poverty after paying for care. We also look at availability, asking member states to ensure that the development of long-term care services in line with the demand in terms of quantity and quality. So as demand grows, there should be more scope to cover this demand, but also there should be more variety, and in particular, more home care, community-based care. We talk about closing territorial gaps, using innovation, digitalization in care provision, and making care services accessible to persons with disabilities. Another block looking at quality. So asking member states to have quality standards for all care settings to be applied to all care providers, irrespective of their legal status, so public, for-profit, not-for-profit, private, so on. We look, the recommendation sets out a number of common quality principles on long-term care that sort of represent our common understanding, which need to be operationalized in a national quality assurance framework. And there is some guidance provided to that respect in the recommendation. And another big block is looking at carers. So we need to ensure quality employment, fair working conditions, to address skills needs, to create pathways to the care sector, and also to protect informal carers, so provide them help, counseling, training, social protection, and help them balance work life and caregiving. And the fifth big element of the recommendation is about monitoring and guidance. We see in many member states, the long-term care systems are fragmented between social and healthcare services, between national, regional levels. So it is very difficult to see the systems in one coherent picture. So we asked member states to appoint national long-term care coordinators for the implementation of this recommendation. They have all appointed them. We have a list published online. Now we cooperate with them. We organize different exchanges, mutual learning, and technical support through them. And then the Commission is also working with member states in another formation under Social Protection Committee to build a common portfolio of common indicators at the European level to help monitor this recommendation. The big milestone we have reached now in June is that after the adoption of the recommendation, member states had 18 months to look at their national systems together with all their national stakeholders and see what measures are needed to be taken to implement the guidance. And we are supposed to provide us to send to the Commission reports on this in June this year. So we started receiving these reports. We have already received them for about half of member states, and they are coming. On the basis of these reports, we will continue our policy dialogue with them. And the Commission will have to report to the Council on progress of this implementation in 2027. So this is a very quick overview of what we have at the European level, but this is just an example of actions that, as I said, the Commission promised to launch as part of its care strategy. We have this network of coordinators. We organized mutual learning over the last year. We had mutual learning with them on quality, on social protection, on workforce. we have a lot of EU funds that follow different rules, and they cover different aspects. So, for example, ESF focuses more on training, upskilling, and working conditions. The EASY program funds social innovation. ERDF can fund infrastructure. As I said, technical support instrument provides technical support for policy design. We have a big facility, recovery and resilience facility, which invests very heavily in many member states in reforms as well as investments. And we have our smaller funding programs. We launched studies, so now we started looking at labor law, how it applies to the care sector, how the occupational health and safety directives, because we have them at the European level, apply, if there are any gaps. We are looking at pathways for third country nationals to join the care sector, and so on. And then we work on long-term care statistics. There is a task force working at the led by our colleagues in the Eurostat, so statistical department of the European Commission, together with member states. They try to improve the availability of the statistics at the European level now. For example, looking how to better cover people living in residential care in the statistics, which at the moment is not the case. And with OECD, we look at the effectiveness of social protection for long-term care. Last year, the Commission set up an European Social Dialogue Committee for Social Services, which will look at the long-term care sector as well, at the working conditions and the challenges in that area. We have a partnership for skills set up by a number of EU-level organizations and social partners, and they receive now EU funding to train long-term care workers. If I remember, 60% of long-term care workforce will be trained by 2030, and the focus there is on digital skills and so on. These are the different fragments of examples. We have an exhaustive list of actions, which we will talk about in a conference later this year in October. And now I haven't mentioned the most important action for this particular webinar is our cooperation with the World Health Organization on long-term care. It has two parts. So the second part is looking at informal carers, which will not be discussed today. But what we are discussing today is the tool that we have been developing to help member states reach and to self-assess the coherence, the integrity of their long-term care systems, and together with all the relevant stakeholders, and try to identify gaps, agree on actions, and so on. You will hear about this. Just to stress, this is very important for us because in many member states, as I said, the responsibility and understanding of long-term care is very fragmented, and it's difficult to get to a common understanding of what needs to be done. And also, we have a lot of interest from non-institutional stakeholders, if I can say, from civil society organizations, representatives of different interest groups, and they can provide a lot of useful ideas and insights into the sector. So there needs to be a way to involve them meaningfully into policy design, which we hope this tool can help member states to achieve. So here I'll probably stop. If you have questions on what I presented, I'm happy to answer now or during the event. Thank you very much.
Thank you so much, Diana. So perhaps actually I will, let's hold all the questions perhaps until the end, once we've had our presentations, and we can collect them there. Yeah, so thank you so much, Diana, for providing us a very good overview of the policy context of what's ongoing at the EU level. So I'll move to share my screen now. And just to give a bit of an update then on the agenda. So I will present on this State of Long-Term Care tool that Diana has mentioned that's been developed in collaboration between DG Employment and WHO Europe. And then we'll move to allow Brian McGahey to present on the piloting experience of this tool in Ireland. And then we'll also move to Maria Kirigianidou, who will discuss about the piloting experience in Greece. Okay, perfect. Yeah, so the motivation for today. So we've heard from Diana about the ongoing policy context at the EU level and how we've been developing this tool then in collaboration. But we really wanted to focus the webinar today about this aspect of multi-stakeholder participatory approaches and how we can use these to build consensus and how we can use them to plan long-term care reforms. So just to set a basis, what exactly do we mean when we're using this big term multi-stakeholder participatory approaches? So what we're referring to is empowering people, communities, and civil society through inclusive participation in decision-making processes that affect health across the policy cycle and at all levels of the system. So we see this as synonymous with social participation and participatory governance. This idea of including people that are not only involved in the system themselves, but also the people who are the targets of these systems to be part of policymaking processes in some form. And this is a very relevant topic. I'm not sure if anyone here tuned into or kept track of some of the ongoing activities at the 77th World Health Assembly, but there was actually, for the first time, a resolution passed by member states on social participation for universal health coverage, health and well-being. And basically, this shows the commitment and recognition across member states that social participation has a lot to add to policymaking processes. So I don't have too much time to go into depth here, but just know that there are a range of activities under this, or a range of recommendations under this, this resolution about strengthening social participation from the side of public sector capacity, to the side of civil society capacity, to research, to allowing sustainable resource funding for this, and so on. And so how this comes into our discussion today is in terms of the State of Long-Term Care Toolkit, which, as Diana mentioned, we've been working on in collaboration. And it's a tool that is aimed to support implementation of the European Care Strategy. And it's more specifically designed to support member states in strengthening their long-term care systems through a sort of self-assessment and strategic planning process. So really fundamental to the State of Long-Term Care Toolkit and methodological approach is this idea that we should be engaging diverse stakeholder groups in the process, not only to build the knowledge base that we have, but also to build consensus, to create collaborations, and to help basically strengthen care systems. So the toolkit itself will be comprised of 3 documents. It'll consist of a conceptual framework for care system strengthening practices, which will also include areas of the care system that we see as essential for considering in reforms. It'll also consist of a data collection instrument that can be used for systematic data collection and for standardizing and organizing data. And then finally, an implementation guide, which outlines this methodological approach we are promoting, particularly engaging stakeholders. And so ultimately, the toolkit will allow for a structured analysis of care systems, allow member states to appraise ongoing and future long-term care reforms, and to identify opportunities for policy interventions. Now, the toolkit is not yet published, so I don't want to give away too much of it before it's formally announced. But just to give you a bit of backbone here as to what the conceptual framework entails. So the conceptual framework of the toolkit is structured along a results chain framework. So we think of this as the population needs. So in terms of care users and caregivers and people with care needs, that this is a relevant aspect to consider. Moving then to the resources that we put into the system, called inputs, moving there to outputs of the system, so what is provided in terms of care services and supports and the quality of these, and then moving on to the system outcomes. So what system outcomes we see collectively based on the care people receive. And then linking this finally to broader societal implications, this idea that as much as we put into the system and we take out of the system, that long-term care systems have an even broader impact on society than just individuals alone. And we refer to this in terms of the quality of life of the population, the health and functioning, work-life balance, gender equity, and so on. So where we're at, the instrument was ready for testing late last year. It was tested in Lithuania late last year, early this year. It moved on to be piloted in Ireland in March 2024, and then more recently in Greece, although the Greek activities were under the scope of another project called Health IQ. And so finally, the toolkit will be published later in October 2024, along with the national reports of the results. So as mentioned, we piloted this tool, the toolkit in 3 countries, so in Ireland, in Greece, and in Lithuania. And instrumental to this process was a team we comprised here. So this team was comprised of a national coordination team, always a focal point at key national bodies. This was often Ministry of Health or Ministry of Social Affairs, sometimes both, but basically stakeholders that have responsibility for policy making and long-term care. The team also comprised a long-term care assessment team on the side of WHO Europe, including international and nationally recruited experts. And then finally, our colleagues at DG Employment that are based in the long-term care policy expert team. So I've talked about then this state of long-term care methodological approach, but what do we mean by it? And what do we recommend as a way for states to carry this process out and engage stakeholders? So first, through the state of long-term care, the first step is gathering evidence. So basically trying to bring together an evidence base as wide as possible, partially through data collection, through desk review, but also by reaching out to stakeholders, asking them to fill out relevant sections of the data collection instrument, or similarly asking them to signpost key pieces of evidence that are crucial to consider. And from here, the next step was to carry out stakeholder expert interviews, so having either one-on-one interviews with individuals or also focus groups focusing on a specific topic, but basically with the idea of expanding our knowledge base, but also having the opportunity to have a bit more of an interpretive feel to the discussions, a more analytical feel. So allowing for deeper discussions on what the bottlenecks and what the challenges really are in the long-term care system. And this was also complemented by site and provider visits. And then finally, all of this accumulated in each country to a national policy dialogue event, which brought together stakeholders from across the whole system to engage in dialogue and to build consensus on what the system goals should be, and conditional on these system goals, what priority interventions have to occur to get there. And so until now, I've been speaking in quite broad terms of stakeholders, that we've engaged stakeholders, but what does this really mean? Who were we engaging and who do we recommend to engage in such a process? So on the one hand, we engaged with stakeholders that are involved in the planning and the design of long-term care systems. So policymakers in key ministries, but also individuals at regions and municipalities that hold responsibility on this side. We also engaged individuals involved in the provision of long-term care. So service providers, regardless of ownership, long-term care workers, unions, civil society groups, and also representative organizations that represent the interests of these different groups. And we also engaged with stakeholders involved in monitoring and analyzing long-term care systems. So individuals at regulatory authorities, at the ombudsman in the country, in research and academia, and in statistical authorities. And then, of course, because care users, informal carers, and communities are really at the heart of care systems, we tried to also engage individuals in this sense. And most often, this took the form of engaging advocacy groups that represented the interests of these different individuals. And of course, it goes without saying, I think we're all among friends here, and we all have a pretty good overview of long-term care, but we know it's a very dynamic field. We know that in many countries, responsibilities for long-term care often fall within social protection, but a little bit also in health. And so we see such a mismatch of responsibilities, whether for financing, organizing, and delivering long-term care, that it's often a split responsibility, but with porous boundaries. Not always, sometimes some countries have it more integrated, but we often see this. So in engaging such a broad group of stakeholders and trying to be as inclusive as possible, it is necessary, and it was necessary in our case, to really try to engage stakeholders from all of these different sectors that contribute to long-term care and improving the quality of life of people. And so for us, what this looked like in numbers, so in terms of discussing with stakeholders one-on-one, carrying out interviews and discussions, this accumulated to over 160 experts across the 3 countries. In terms of the policy dialogue events, this accumulated to over 100 individuals participating. And all of this has been brought together into 3 national reports that summarize the findings and recommendations of policy priorities in the 3 countries, which will be published later this year. And so if it's not clear yet, we are pretty I guess, yeah, we're quite keen to encourage this approach of multi-stakeholder participatory engagement in processes, because we see a lot of benefits that this brings to policymaking, to monitoring progress, to reforming systems, and so on. And we were able to also see this in practice. So just to highlight, just to summarize a few key benefits of such an approach to reform processes, we see on the one hand, it helps to create a shared vision and shared understanding of responsibility. With care systems being quite fragmented, it helps to bring people together to agree on what the system is and to agree on responsibility for its development. It helps to bring together diverse perspectives. So incorporating the different stakeholders who have different roles, different priorities, different experiences, it helps to bring a more comprehensive, holistic view of the system. It allows for opportunities for interaction and exchange and helps to facilitate opportunities for further coordination and for further partnerships. It helps to garner support and buy-in and agreement on ongoing and future reforms. It helps to prioritize what the top priority interventions should be that will have the most impact towards the system. And finally, it helps to improve equity in the sense that the perspectives of underrepresented individuals can be considered, and so solutions can be more inclusive. So to sum up, if I have to really narrow these down to two big benefits, essentially, it helps us to expand the existing knowledge base we have to make sure it's more comprehensive and equitable, but it also helps to promote trust, dialogue, and consensus within the system itself, allowing for further opportunities for collaborating, engaging to discuss priorities and co-create solutions. Now, I'm more or less at the end of my time to chat, but of course, I just wanted to say a thank you to those who had participated throughout these piloting experiences and participated in the policy dialogue events. So here was in Lithuania, here was in Ireland, and here we had in Greece. Of course, this whole process could not be made possible without the participation of stakeholders from across the system. So that is all from my side to give you a primer on what the state of long-term care is and what this multi-stakeholder approach that we are vouching for is. So I'll stop sharing. So now we're going to go to the interesting part of allowing a discussion for our presentation on the piloting experiences in Ireland, followed by Greece. So first I would give the floor to Brian McGahey, who's going to present on the case in Ireland. And Brian is based at the Department of Health in Ireland and was very instrumental in the process, being our national focal point. So Brian, I give you the floor and I will share my screen for your presentation.
Yeah, perfect. Just while that's loading, I suppose, hello everyone, and thank you for this opportunity to speak to you today about Ireland's experience of the State of Long-Term Care Assessment pilot. As Cassandra said, I work in the Department of Health in the Older Person Strategy Unit, and we help to coordinate Ireland's response as part of this pilot. So over the course of the next few minutes, I'd like to briefly outline how long-term care is organised in Ireland, including some of our ongoing reforms, and highlight some of the successes and opportunities for improvements from a policymaker's perspective with this pilot. So to begin, long-term care in Ireland, as understood using the WHO and European Commission's definition, is for the most part overseen by three government departments: the Department of Health, the Department of Children, Equality, Disability, Integration and Youth, or the CD, and the Department of Social Protection. The Department of Health and the CD primarily provide benefit in kind supports for people with long-term care needs, such as home support and rehabilitation services, with such services being provided directly by or on behalf of the Health Service Executive or the HSE. The Department of Social Protection, on the other hand, provides cash benefits, including income supports for people with disabilities and for family or informal carers. So while this broad government approach ensures that a wide range of care needs are addressed by policymakers with relevant expertise in the corresponding government department, it can also present some challenges in terms of oversight and consensus building in certain areas, as policymakers may not routinely engage with their counterparts in other government departments. This challenge is further entrenched by a lack of a singular overarching long-term care policy or strategy in Ireland. However, to address this, a number of cross-government strategies and working groups exist to support specific care groups. So some examples of these are the National Care Strategy and the National Positive Ageing Strategy, with individual government departments, including those not listed on the previous slide, leading on actions under their remit. So at present, Ireland's health and social care system is undergoing the most significant programme of reform and expansion in the history of the state under what we call Sláinte Care. So this has involved overhauling what was a minimal, disjointed service to a modern health service executive providing care for over 5 million people with an overall budget in excess of €23.5 billion in 2024. Under Sláinte Care, we've made unprecedented progress in transforming our health and social care services and moving towards universal healthcare and improving health and well-being for all throughout the life course, with the aim being to deliver the right care in the right place at the right time. In long-term care specifically, a key focus of our Sláinte Care reform programme is to promote ageing in place. So we recognise that the need to enable people to age well at home and in their communities for as long as possible with the correct wraparound supports. For example, in the area of older person services, building on the significant increases of recent years, our investment, including residential care and home support services, have seen a 30% increase in funding since 2020. And so what this means in real terms in 2024 is that in older person services, there will be over 300 day centres operating across the country. More than 2.7 million meals on wheels will be delivered, 22 million hours of home support will be provided, and through the nursing home support scheme, over 23,000 people will receive financial support. As part of these reforms, Sláinte Care is also reorienting the model of care towards primary and community care, and we are expanding these sectors to ensure that people are treated in their locality or as close to their homes as possible. An example of this is that eligibility for free medical services has been substantially expanded in recent years, which improving access to healthcare services to those who need it most. And today, more than half of the population are now eligible for either a medical card or a GP visit card. This is further supported by the rollout of the Enhanced Community Care Programme, which is reforming service delivery of primary care and community care through the provision of integrated care pathways linking primary care, community care, and acute hospital services for patients and providing greater levels of care closer to home. Next slide. So turning to the pilot, the main activities in Ireland took place in March of this year. So during that period, the WHO assessment team completed a desk review of academic and grey literature related to Ireland's long-term care system. And then additionally, with the support of the Department of Health, a survey on long-term care services, a 10-day country visit to conduct expert interviews, and a policy dialogue on long-term care transformation were completed with a wide range of stakeholders, including government officials, the HSE, academics and service providers and representative bodies from older person services, services for people with disabilities, primary care and family carers. And as I previously mentioned, under Sláinte Care, Ireland's health and social care landscape is undergoing a complete overhaul. And this means that at present we very much have a system that is in flux, which has both complicated engagement with the pilot and is evident in the preliminary findings in the country report. Next slide. So overall, the pilot was a useful experience for Ireland to complete. I believe others may talk later in more detail about the practicality of member states completing this assessment alone. However, in our experience as a policy unit with limited remit over the wide range of areas covered by the pilot, the contribution of the WHO research team was both useful in terms of the provision of technical expertise that, while it is available within the Department of Health, is a very limited resource, and in terms of acting as an honest broker to help build engagement with stakeholders, particularly those who do not necessarily see themselves as belonging to the long-term care system. In particular, the policy dialogue was a standout activity in terms of impact in helping to build consensus around a broader definition of long-term care and in bringing together over 40 different stakeholders to identify common challenges and desired outcomes for people regardless of their care needs. And as a result of this, it helped to identify 3 priority areas for intervention linked to addressing workforce constraints, improving service integration based on needs, and increasing focus on the voice of service users. And finally, this process has provided us with a useful evidence base to support ongoing and future policy initiatives across the full spectrum of long-term care services through the production of a country report. Next slide. So turning to some areas that could be improved from our experience. Firstly, the use of the term long-term care as a catch-all for services for all people with care needs proved to be an inhibitor to participation amongst many stakeholders outside of older person services. In Ireland, the term long-term care has quite a strong association with nursing home care. So had we opted to use a broader term such as social care, it may have been easier to engage both government and non-government stakeholders and encourage additional participation. Secondly, the data collection instrument or survey had 2 main issues for us. Firstly, the questions were not adapted to the local health and social care landscape, which made it difficult for stakeholders to understand in some instances. And secondly, the survey was long, with over 100 questions, and was not suitable for sharing with a large number of people, which made it cumbersome to complete and collate. And finally, the time allocated to completing the pilot was misaligned with the amount of work it actually required. So should this initiative be repeated in the future in Ireland, significantly more time would need to be allocated to foster greater participation from all stakeholders. And then next slide. And I suppose I'd just like to take this opportunity just before finishing to reiterate that while the pilot assessment had some issues that I just spoke about, on the whole in Ireland we felt it was a useful activity that provided a snapshot into ongoing sláinte care reforms across a broad range of areas, including older person services, disability services and supports for family or informal carers. In closing, I'd like to thank WHO Europe and for their work on this assessment, as well as European Commission's DG Employment. And just to highlight that the next steps for Ireland in relation to this pilot are to work with WHO Europe over the summer to finalise the draft report for publication, and then to consider the report's findings and what further action, if any, may be required. Thank you.
Thank you so much, Brian. I think it's really interesting to hear from a policymaker's perspective then, the operationalization of this pilot, how that worked internally, and yeah, the benefits, but also the challenges associated with such an approach. So now we will move to Maria Karaganyadu's presentation, who is also working as a consultant for long-term care and with WHO Europe, and was also instrumental in the process of carrying out this pilot within Greece. So she'll be discussing on the Greek experience. So Maria, do you want to share the slides from your side?
Thank you, Cassandra. My name is Maria Karaganyaду. I'm working as research officer at the Care Policy and Evaluation Center at LSE, and I was lucky enough to be part of this WHO work that is currently running in Greece. So the progress in the long-term care system in Greece has been extremely slow over the previous years, and there are three other key characteristics. The governance is unclear, there is limited coordination across different stakeholders, and there is a lack of a unified national legislation or strategy. It is worth saying here that mainly the long-term care is there are limited publicly available publicly services for long-term care, and the main intervention is a program called Help at Home, which is a community care program, and there is an extensive private care. That there are extensive privately care homes. The care homes are mainly private in Greece, and there is a limited number of publicly available care homes or nursing home. And overall, the system is based on heavily on family and informal carers. However, recently, the Greek government developed a national working group on long-term care, and they appointed a national coordinator that is leading that working group. And the aims of this working group is to have at the end a national plan on long-term care, and to agree on a common definition of long-term care, to coordinate long-term care services across ministries, and to undergo an ambitious reform in order to improve accessibility, affordability, and quality of long-term care. The ideal is that reform to be in line with the European care strategy. The experience of the pilot in Greece, the goal was to understand in depth the challenges and the strengths of the current system in Greece, and to bring together diverse stakeholders. During the first mission, we did a focus groups with academics and various meetings and interviews, discussions with key stakeholders, including ministries, the Ministry of Health, the Ministry of Social Cohesion, of Interior, the Ministry of Labor, most of the NGOs that are running long-term care services in Greece, Greek charitable foundations that are giving they're giving a lot of funding to long-term care services. And we also spoke with some staff from the Help at Home program and representatives of the private care homes. I forgot to say that the thing with the long-term care in Greece is that there are at least 4 ministries at the moment that are involved in long-term care services. Each one has its own, let's say, responsibilities, but they don't coordinate their actions. The second part of the mission in Greece was the policy dialogue. I'm going to start from the last point of my presentation, because I think that this was the value of this pilot dialogue. This was the first time that in Greece we managed to bring together stakeholders that they never talk or corroborate before. And we managed to bring them, all of them together in order to discuss long-term care services in Greece. The objective of the national policy dialogue, the objectives were to facilitate dialogue and promote multi-stakeholder consensus, and secondly, to reflect in cooperation with key national stakeholders on priority areas of action for improving long-term care system. There were around 50 participants. We selected those people purposefully in a balanced manner, and it was a diverse group of stakeholders who all of them, they in some way, somehow, in all aspects of long-term care, they have contact with long-term care services, or they are running long-term care services. During the process, participants worked in small groups. In each group were asked to unfold their discussion based on 2 main questions concerning the goals and outcomes of long-term care system, and how we could get from the current situation and the current system to a system that it will be more sustainable and more equal. That is a desired long-term care system in Greece. Then a plenary discussion and the synthesis of proposal across groups followed based on the theory of change. What were the challenges? I think that lack of data, there are a lot of challenges there, but the lack of data is one of the main issues in Greece. The lack of data is everywhere. It's concerning people in need of care. We don't have that data. People using the services. We don't have the data on a number of services, beds, staff, detailed allocation of funding. Older adults are taking benefits. Second, it's the lack of unanimous definition of long-term care. People, when they are talking about long-term care in Greece, and especially each ministry is coming from a different perspective in terms of the long-term care. So there is a need to be a unanimous definition of long-term care in Greece. And finally, it's the lack of collaboration between the ministries. There are fragmented policies across the country and interventions, at least so far. However, there are some opportunities as well. Developing a shared vision and shared sense of responsibility and accountability of the development of the long-term care system. Another important opportunity is sharing examples of good practices in terms of local and national level. Building collaborations, is a key. It's going to be a key for the country when they will or if they would like to have a better long-term care system. And finally, collecting feedback and input on the preliminary findings of the state of the long-term care assessment. However, there are things that we could have done differently. The first thing that we could have done differently in our pilot in Greece, it was that we could include, for example, the perspective of people that are using the existing services. However, there is a lack of a national representative body, and it's not easy to have access. The second one, which is key, it's crucial, is including the perspective of informal carers. But again, there is a lack of a national representative body, at least for older adults experiencing care needs. And finally, we didn't manage to do to visit some services. For example, some community care programs like KIFIs and CAPIs, help at home, although we had some interviews with the staff working at Help at Home program. We didn't manage to visit those kind of services. And we could also visit publicly available and private care homes. In terms of the outcomes out of this policy dialogue and the previous focus groups and interviews, I'm not gonna go into detail, but I would like to just briefly mention some of the key, what the participants felt as the key priorities for the Greek long-term care system is, of course, affordability, support for caregivers, increasing fiscal space, and actually make sustainable funding, at least for the existing services. Coordination is always one of the key issues. Workforce, mapping of current long-term care workforce, a training of the workforce is crucial, and quality, strengthening quality assurance. What we found is that there are some care homes that are running without licensing at the moment in Greece. There is a strong need for supporting the caregivers. Equity in terms of geographical and gender equity is another key issue. Integration and coordination. And finally, last but not least, is improving data and monitoring of the system, at least establishing a minimum set of reporting requirements and processes for collecting data. Our next steps include, we're trying actually to put all this information to the State of Long-Term Care report, which is focused on Greece. And we are trying to bring together all of the information that we gathered. And we are trying to highlight where are the priorities in the system. And the priorities that if we focus on those, they can strengthen long-term care system in Greece. What is important to keep at the end is that the Greek health and long-term care systems are faced with a considerable challenge of transforming to adopt and respond to demographic, economic, and societal pressure. But at the same time, this is a unique opportunity to rethink the grounding of, and actually rescheduling the grounding of the systems and build on stronger and more sustainable foundations. One key in order to have that goal is partnership and coordinated action. And this is something that is missing at the moment across many policy areas, across sectors, and across governance level. The WHO pilot in Greece, we feel actually that was extremely useful for trying to build these bridges for participation and coordination. Thank you.
Thank you so much, Maria. And yeah, I hope this provided a nice overview to everybody that's been tuning in to what this process looked like piloting in Ireland and Greece, two countries that have quite different systems, but that have quite ambitious reforms and ongoing policy activities. So before we shortly go to a quick Q&A and discussion period, I did want to give the floor to Stefania Linka, who is Technical Officer for Long-Term Care at WHO Europe and who has been leading on WHO Europe's side. So she's been very instrumental to this whole process. And I want to give the floor to her for a few minutes to make a few comments.
Thank you so much, Cassandra, and everyone. Not much to add. You've done a fantastic job. Thank you. It's been so useful for me to get the overview as well. And I've been very impressed to hear how much we've achieved in this short time. I wanted to make one clarification because I think this is quite important for understanding how the whole process is progressing. The application of the State of LTC assessment in Greece is not part of the original plan with the Commission, but rather it is, I think, not so much as a pilot as a first application of the developed and piloted instrument, although before its publication, to coincide and support an ongoing reform. So this was an opportunity that arose, and we jumped at it to try to expand a methodology that we thought was useful. And it's very good to see that there has been quick interest in taking it up. We hope many more countries will engage with us over the next years. Now, I wanted to reflect on a few things because these are my takeaways from the whole process over the last year. I want to commend our colleagues in the Commission, but also the team that worked on this instrument. Because if we are being honest with ourselves, it has evolved a lot from when the concept was developed to what we expect to deliver in October of 2024. And I think this is a credit to us, that through the validation and piloting process, we have really tried to take on board the lessons learned. And we've evolved from an idea to develop tool focused very much on measurement towards developing a more flexible and general approach on developing a useful evidence base. Beyond monitoring, towards supporting system transformation and trying to generate and highlight sources of knowledge that are not usually captured by standard statistics and data that are so valuable and that are important to fill these enormous data gaps that Diana was talking at the very beginning. The other thing that really sticks with me, and it's an ongoing challenge, thank you so much, Brian, for clearly stating it. We have struggled throughout to find a common terminology. This is a challenge that we all share at national level and all the more at regional and global level. But it is a challenge we have to rise up to. If we do not start narrowing things down and specifying what it is we're talking about, we're going to have to keep talking past each other. So this is my call to everyone in this call to support us in what is truly a challenge that we are trying to face up to. And finally, I want to say, and this to me is probably the biggest value I think we can take from the process, that while the translation of the tool is difficult, we've tried to translate this in national languages. It is extremely difficult, and its flexibility is inherently limited. What truly is versatile is the approach to participation. And this has been very easy to translate, very easy to adapt. It just took its own took life of its own and carried us through the process and helped us in very different situations, in very different systems, with very little time, as I think Brian correctly pointed out, get to the core of it. So these are my lessons, and I'm very curious to hear your reflections because the learning process continues for us. We still have time until October to take on board your insights and your inputs. So please use this opportunity and write to us afterwards. We're very welcome. We're very happy to receive input and further feedback. Thank you very much.
That's great. Thank you so much, Stefania. And I think that segues very nicely then into the discussion and question and answer period. So I would first open the floor. If anybody has any questions about any of the presentations that have taken place, whether in terms of the State of Long-Term Care Toolkit itself or on the piloting or first application in Greece and piloting in Ireland, please, by all means, either raise your hand or place it in the chat. Catherine, I see your hand is up, please.
Thanks, yeah, thanks. That's really interesting. I'm from the University of Birmingham in the UK. Yeah, really found that absolutely fascinating. I think part of it is kind of where you set the edges of the long-term care system, because I think you could have talked about housing ministries being relevant here. You could have talked about migration. That's a big part of any social care system. So that, it is hard, I think, to put boundaries around it. You talked, I think, particularly Cassandra, around consensus building, and I guess what I didn't hear in any of them was conflict, differences, but certainly in the social care research that I've done, people, perhaps working age people with a disability, often don't want care worker registration, for example, because they think that's a constraint on choice and control. You might find that, different views of risk. It might be that parties of the left want more state provision and parties of the right want more private provision. So I suppose, is it, were some of those tensions coming through, and is it kind of realistic to get the kind of multi-party, multi-stakeholder consensus that you talked about?
Yeah, thank you so much, Catherine. I think this is a really great point that you've raised. And I just want to first start off by saying that in engaging a diverse group of stakeholders, we did take into consideration housing, for example, and we did try our best to engage stakeholders in that regard, with the understanding that with agendas of pursuing aging in place and trying to keep people in their homes for as long as possible, that this does include then the consideration of housing and ensuring people have the proper, good quality housing that allows them to stay in their homes for as long as possible. So we did try to, as best as possible, engage in that sense. And it is true then, when we have this very broad view of long-term care and what contributes to long-term care, there are a lot of these considerations to consider in the process of engaging stakeholders. In terms of the conflict, so I will just say something very quick, and then I would open it also to Brian and Maria if you'd like to jump in and say something there. Of course, it is true. Everybody coming from their own experience, from their own roles, their own perspectives, there will be a lot of tensions in a long-term care system, I think, in terms of what the priorities might be or what some of the challenges may be. But something we really tried to focus on in our approach when we brought together stakeholders for this national policy dialogue was to first start off at the point of what do we want to see in the system? What is the goal? And I find that this is something everybody can agree on, right? We agree, we think people should have affordable care. They should have good quality care. It should be accessible. Informal care should not be burdened, and so on. So we always try to start from this convening point of, we're on the same page here. We all want to see this ideal vision of long-term care. And then taking a step back and starting to talk about, okay, what does this look like in practice? And what priorities, what interventions do we need to get there? And we found this was always nice to try to set that kind of communal feeling first before trying to progress. But yeah, of course, it's not without its own challenges. So I also raise the floor to any of the other speakers if they'd also like to jump in and make a comment in this regard.
Yeah, I suppose I can start just from the Irish perspective, just to say in relation to housing, they were, I didn't include them on the list, but there were government officials from the Department of Housing who were involved as part of this process. And we have a lot of quite innovative programs related to healthy, age-friendly homes, etc., that we run as well, that were included as part of this process. I just didn't include them today. There was a lot happening. Just in relation to conflict, though, just to mirror kind of what Cassandra said, that really there was quite a lot of consensus in terms of what it is that we should, where we would like to be. But the conflict came into, and I think you alluded to in your question as well, as to how do we get there? And I think that is something that at the moment it still remains to be seen how we continue to engage with this process. How do we actually go into that nitty gritty, and how do we re-engage with people to actually to find real consensus and, well, what are the priority actions we need to take to achieve these common goals or outcomes that we're looking for?
Yeah, and from the Greek perspective, I would agree that there is indeed a consensus on where we would like to be, what kind of long-term care system we would like to have. However, at the moment, we are still trying to find what is long-term care and how we define that. And this was one of the crucial things and one important aspect of where we have to go in terms of long-term care.
Thank you, Maria. And I do see actually there have been some comments in the chat, so I just raised those. I see Desmond O'Neill from Ireland, who's from the Irish Society of Physicians in Geriatric Medicine. I see you've raised this point just about implementing inter-RI within the long-term care sector, and some of the challenges there. And I do have to say this was something that we did discuss in the context of the State of Long-Term Care Assessment process, and in discussing in the policy dialogue about the challenges there, and still the optimism that this is a good tool to use, at least in certain regards, but that there are necessary or there could be scope for continuing to pursue this to make sure that it is properly rolled out. So I can give you the word in a second if you'd like to expand on your comments. And then Desmond, I see you also had a question about whether the toolkit is available. It won't be available until October this year. That's when it will be published. And your second question there was about, does it try to specify the professional groups which should be involved, including, for example, gerontological nursing and geriatricians? So yeah, in our implementation guide, basically the implementation guide aims to provide step-by-step guidance on and recommendations for how to carry out this process, including the different groups that we see as being relevant for long-term care, and groups that could potentially and should be involved in and engaged in this process. So indeed, we do try to be as inclusive as possible in terms of the groups that should be consulted and included in this process. So Adelina, before I give you also the floor, I don't know, Desmond, if you'd like to say anything further about your first comments, if you're still here.
Yeah, this is very interesting and fascinating to see how this toolkit is evolving, and experiences of implementation, and really looking forward to hear even more detail about the experience of all these participatory approaches. It sounds fascinating. I was wondering about and I know you probably have had that in your minds, but the fact that in many countries there isn't really a national policy, or the national level doesn't have a very big role. So I'm thinking of Spain, but also maybe some Scandinavian countries where policy is very much at a big municipality level. And I was wondering about the scope of adapting this toolkit to this regional and maybe local levels as a tool of assessment at these different levels of government.
Thank you, Adelina. And I see, Stefania, you've come back on camera, so I'm not sure you want to jump in and answer this.
I would, yes, thank you. Thanks a lot, Adelina, for this. And I hope Diana can also jump in here, because once again, it's half an answer and half an invitation. This is something that we recognize needs to be added through. I think as we went through the assessment process and the piloting process, it became clear that there would need to be additional adjustments so that we can use what we have effectively at regional level. But we do think that it's a promising approach towards developing some sort of internal monitoring and development, quality development systems in long-term care, which the national level could use to support regions, and local authorities could use to understand how to allocate funding. But there is, again, an adaptation process that needs to happen there. So we are actively discussing and thinking and looking for regions in Europe to work with who are willing to engage with us and to help us, as Lithuania and Ireland and Greece have, by being courageous and working to develop with us the technical tools themselves. And hopefully this will happen somewhere towards next year. Diana, I don't know if you want to add something to that.
Yes, I mean, the tool was not tested in a region as a setting, but maybe it didn't come out from the presentation. In the end, it will be an off-the-shelf support, but it will be flexible, adaptable to whoever wants to use it. So if it's useful for the regions, then they can take it and adapt to their specific circumstances. So hopefully in that way, it will be helpful to them as well.
Thank you, Diana. Are there any other questions from the audience? So I see Desmond has responded saying his button was not unmuting. That's unfortunate, but so he says a key challenge is ensuring that the multi-stakeholder process is indeed inclusive, and certainly as Irish geriatricians, they're happy to review the draft and comment. Thank you, Desmond, that's very kind. So I also see there's another question from Anna Magdalena Ordonez Cruikshank, and she's asking, is there a consensus of a definition for quality specific for long-term care? Oh, that's a good question. I think this also, this certainly brings up, much research, much literature that's been put together over the last years about how we really define quality in long-term care. And if I can say so, I'm not sure we came to a consensus necessarily in each of the pilots or in each of the countries what exactly quality in long-term care is. But I think that there were a lot of common elements that we can all also agree on. When we refer to quality in long-term care, often terms like person-centeredness was coming up, ensuring that people can receive the care that they want in the setting of their choice. And certainly in a lot of the conversations, a key priority intervention was also ensuring that there are proper quality standards in place for all service settings across the continuum of long-term care, and that there are quality assurance mechanisms to ensure that they are followed. and just basically having a national quality framework in place. This was often something that was discussed. I'm not sure if anyone else wants to jump in to add their experience. Stefania?
Yeah, just to add to that, again, maybe Diana also wants to talk about the principles and the recommendations, but I think what we're trying to do on WHO Europe side, and please stay engaged with us to help out, is towards the end of the year, we will publish a technical document where we try to get closer to a definition and the key principles that need to underpin quality management in long-term care rather than monitoring and assurance only. This is an effort that is also based in academic, technical literature and evidence review. We are currently working with countries to think of ways to apply it, to think of measurement to put behind it, and very importantly, to figure out ways that we can incorporate user-reported outcomes into quality definition and monitoring. But it's very much an ongoing process and a topic that frequently we are asked to support member states with. So very much work in progress and very much an area where we welcome insights from the academic community in how we can translate the knowledge to practice. Diana, do you want to jump in?
Yes, I can contribute because, as I mentioned, we have a long-term care recommendation for the European Union, and it has set out a common understanding of quality in the form of common principles that cover prevention, respect, dignity, person-centeredness, as was discussed, comprehensiveness, continuity, and focus on outcomes, which are expressed there as quality of life and ability to live independently. And there is also guidance on how to ensure quality, how to work with. Well, we talk about quality standards, but also about the need to ensure continuous quality improvement and so on. So we have, it's not a single definition, but we have an understanding, and these principles actually come from quality principles for social services that member states agreed as voluntary in 2010 even, so they still apply. But to narrow it down, to make it operational, we are engaging with member states via mutual learning and via such tools as this one, where we try to pinpoint, what specifically needs to be in long-term care systems for this to happen.
Thank you, Diana. So I see we had a few other comments too. I'm probably not pronouncing your name correctly. I apologize. Narada, who has said that they've recently completed a literature review on this topic, which they will soon submit for publishing. We'd be very interested, so please stay in touch and do send that to us when it is published. We'd be very keen to read it. I also see we have one more comment from Desmond saying the tension over public / not-for-profit and private provision needs to be addressed in some form, particularly over leadership, governance, as well as terms, conditions, and professional advancement within the sector. I can just say that at least based on our experiences in piloting across the countries, we have tried to be as inclusive as possible to really make sure that that in terms of different ownership of service providers are also included in the process, to ensure that these different perspectives are represented. Of course, this is all very relevant to consider, and it's important that we have a comprehensive understanding the different perspectives and the different experiences from these different groups. So absolutely, we definitely saw this as a very key aspect in terms of engaging stakeholders. Okay, I take silence as no more. So I just want to say also, thank you so much from my side to everybody tuning in. I think this has been an interesting discussion, and I hope you've also found this interesting. And just finally, I also want to say again, as a big thank you to everybody who has been involved. I do see some familiar faces, some familiar names, individuals that were involved in the processes of piloting across the countries, individuals that provided their input into the process, and that participated in our different activities. We're very appreciative. And of course, those processes could not have been possible without you. So it's a big thank you from my side to everybody for being part of that. And otherwise, I would pass the floor to Adelina then to close out the webinar if there are no other comments.
Thank you very much. And thank you very much, Cassandra, Stefania, Diana, Maria, and Brian for the presentations, also for wanting to share your work and experiences with the observatory. We're learning a lot from this. We're learning, and we will be staying tuned to when you publish the report, and we hear how this tool keeps developing and shaping up. And I think it is a great progress in terms of what's available. And I really like the fact that this tool, compared to previous ones in the past, is very much about participation and multi-stakeholder engagement. So congratulations on this work. I'd like to mention, I forgot to say at the beginning, that this webinar has been organized by the Long-Term Care Policy Interest Group at the Global Observatory, and my colleagues Catherine Needham, Wei Yang, and Johanna Fischer are part of the steering group. We're very happy to hear suggestions and offers to present in this series of webinars. I've put in the email at the chat, but you can also contact any of us. And we'll see some of you at the ILPN conference in Bilbao. We have some organized sessions there from this long-term care policy interest group. And we are planning a next webinar on the long-term care policy focusing in Latin America, probably in October. We'll let you know the date very soon, and we're taking ideas for future webinars. Thank you, and wishing you all a great day, and see you the next webinars.